Good afternoon, everyone, and thank you for joining us. I'm Sarah Hoffman, Alberta's New Democrat Shadow Minister for Health and the MLA for Edmonton-Glenora, and we're here on the traditional lands of the territory of Treaty 7 First Nations, as well as the Métis Nation. I'm joined this morning by my colleague from Calgary Varsity, Dr. Luanne Metz. She's also the head on the future of healthcare for our team. And we're also with Joe Ceci, the MLA for Calgary Buffalo, where we are right now. We all know that Adriana LaGrange was a terrible health minister, and as a result, she lost control of most of her department. In the fall of 2023, LaGrange directly interfered in weakening the vaccine campaign, refusing to let public health officials use the words COVID or influenza. This reduced uptake and wastage was a direct result of undermining her own department's efforts to promote vaccines. Now, as the minister responsible for preventative health, she's telling many Albertans who want to avoid getting COVID that they have to pay out of pocket if they want a booster. This is dangerous, it's callous, it's anti-science, and it's anti-public health. But the UCP government cares more about advancing American-style healthcare, making life less affordable by charging you for health services. They promised they wouldn't do this during the last election, but it's clear that they broke that promise. They've also increased costs for all Alberta seniors. So to talk more about that, I'm going to turn things over to Dr. Luanne Metz, who will highlight another example of what we are talking about. That's you. Yeah, right there.
I want to share with you some of the reactions that our MLAs have been getting from Albertans about charging for COVID vaccines and hiking seniors' prescription costs. Quote, "This is unacceptable and shocking that a province as wealthy as Alberta isn't on top of protecting our citizens from serious illnesses." Another comment, "Yet another decision you're making, Premier, forcing seniors on limited income to pay more for their medications. This will result in some seniors skipping medications. You are abandoning them." The Premier knows that people are struggling with the cost of living and prescription drug costs. She said it herself that seniors have told her how high their prescription drug costs are. For her to make them pay more for this is unconscionable. Thank you, and we will now answer your questions.
All right, we will now go to questions. Just a reminder for those joining us from Zoom to use the raise hand function, or you can also use *9 if you're calling in to get into the question queue. We will do a quick look for questions in the room first.
Let's see.
Edward from City News. Either one of you can answer this, but what is your reaction to also healthcare workers also having to pay for this vaccine as well too now in the province?
It's outrageous that we can't protect our healthcare workforce. We know that one of the biggest struggles we have right now is workforce, and now we're going to make them pay out of pocket to be safe at work. This is outrageous. We know that Health Sciences Association have just put out a call asking or demanding that healthcare workers be provided with vaccines free of charge.
Can I add one other thing? Thanks, Luanne. Yeah, we absolutely agree with the Health Sciences Association, their president, Mike Parker, in this call. You might recall that during the worst of the COVID outbreak, when seniors were dying in long-term care and assisted living facilities, that one of the main reasons that they said the spread was happening is because healthcare workers were working in multiple facilities and they were getting COVID and moving it from one facility to another. The best way to protect each other, including those frontline healthcare workers, is for as many of us to get vaccinated as are willing, to have herd immunity. And by charging people to pay to protect themselves, their patients, and their loved ones is absolutely unconscionable. And it's clear that Danielle Smith announced this, 4:30 by a quiet press release right before the G7 when everyone was going to be focused on other things. But she knew that her motivated anti-vax political base would hear about it. And here we are a week before the 3 by-elections, and the vote will happen there. And she's doing things that are anti-science, anti-public health, and dangerous for Albertans, and going to drive up the cost of living. And no matter where we go, we hear people talking about healthcare and affordability. And this really cruel move on a Friday afternoon undermines both of those.
I guess also as well too, why do you think the motivation, I believe the province has said waste, but do you believe it has to do with anything with one of those by-elections at least, catering to voters?
I absolutely think that they are politically motivated in this. And that's one of the reasons why we saw the waste, because they wouldn't let public health officials say the word vaccine. They wouldn't let them say COVID or influenza. They really tried to drive down confidence in vaccines and in public health. And surprise, surprise, a lot of people didn't get vaccinated, and there was waste. If they want to make sure we don't waste vaccines, they could let public health officials, the chief medical officer of health and others, speak freely without fear of retribution. And Dr. Metz can maybe add a little bit more about some of the nervousness that healthcare workers are feeling right now.
The healthcare workers are intimidated at this point, and afraid to speak out, such that only a union can speak for people because the individuals can't. The Alberta Medical Association needs to speak for people because the individual physicians often can't. And people that have any level of meeting or consultation with the government on their plans have to sign non-disclosure agreements to even talk about what they're talking about. And so everyone is afraid of saying anything right now. So healthcare workers are intimidated. They're also feeling that their voices, even internally, to solve small issues and problems within a discrete workplace are disregarded. And a huge part of work satisfaction and maintaining your workforce is to have people that feel that the work they do is important and that they're contributing to it. And that is being undermined every single day by this government.
Next question, name and outlet, and who you'd like to direct your questions.
Amar Shah, City News. Another infectious disease is measles, and the cases are on the rise here, and it's the worst it's been in half a century. And it's also due to low vaccination. And now with COVID having to pay for the shots, what do you think it says about the priorities of the government, and what would your message be for the public in terms of vaccination?
So the public have the opportunity to be vaccinated, which is the best mode of prevention for many illnesses, definitely for measles, but also for COVID. It's the best preventive measure people can take. But it does require communication, education, and support so the public are aware that this is what they should do, and that it's advised, not just an option, and that they should get out there and actively protect themselves and their children. And we're seeing the consequences on largely children with measles, poor, harmless children that are the victims of the lack of proper public health that's happening in this government. We have nearly as many cases in Alberta as there are in the entire United States right now.
I just have one really quick question. Mark Flanny with CTV Calgary. What is your thoughts on the lack of consultation with pharmacists? It feels like they learned from us on Friday through this media release. Just your thoughts on that side of things, that nobody was really told what was happening here.
It's routine that this government doesn't consult or even inform ahead of time the people that need to know what's going to be happening. For example, they made the announcement recently about moving much of public health into different pillars or groups. They're moving the medical officers of health from the regions into Alberta Health, but they haven't yet spoken to them. They know from the news this is happening, but they haven't had a decent discussion. It is routine for this government to make announcements without widely consulting. They may consult some of their friends or take the ideas from their friends, but they're not consulting and they're not even informing. So if people don't get a fax or a memo that this is happening, they don't even know. And people being our pharmacists who need to act on this.
It's a low barrier.
One last
Yeah.
pass for questions in the room, and we'll move on to Zoom. All right, so first up we have Sarah, Global News. Sarah, your line should be open.
Hello?
Hi, Sarah.
Okay, sorry, just making sure.
I'm glad you did.
Thanks. It's quite interesting. I feel like when the province is saying that there was so much vaccine waste, looking at the rest of Canada today, like just a quick look, it doesn't look like any other provinces are moving in this direction. But that said, like, do you think there could be some logic or reason here for having the COVID vaccine optional? Like, are we at a point where this could be something that is maybe not as needed as it was before?
What we need is a government that actually puts the health and well-being of all Albertans first. And what we have with Danielle Smith and the UCP is a government that cares more about appeasing fringe groups that they are trying to keep in their party. It's dangerous, and it is not driven by evidence. The vaccine's always been optional. If you wanted to be able to do certain things, you had to demonstrate that you chose to get it. But one of the reasons why it's so important for public health to feel confident in doing their jobs is so that they can share evidence and information to ensure that all of us are doing everything we can to keep each other safe and ourselves safe. Dr. Joffe made it really clear that he knew that the measles outbreak was coming a year ahead of time, and that he raised this with leaders in the UCP. And of course, we know that they did nothing. And now our numbers, as Dr. Metz said, we have almost as many cases in Alberta as we do in all of the United States. And of course, their population is so much higher. So if the government wants people to be making decisions to support each other and be healthy, they should enable public health officials to speak up. And they are telling us that the best thing we can do for ourselves is make sure we have the full range of vaccines, including there's a lot of people out there who haven't had their second dose of measles and they don't know it because it wasn't routine. If they were born around the same time as me in the 80s or even the early 90s. So there are a lot of people who could be under immunized for measles. And we, of course, know that there are a lot of people who want to get the COVID booster this fall. But saying that you're going to have to pay at least $100 out of pocket is going to be a hardship for many people, including seniors, including healthcare workers, and of course parents with children. That's a big expense, and we should be doing everything we can to make life more affordable and to drive down pressure on our hospitals. Instead, the UCP is telling people that they're going to have to pay more for their drugs, so fewer people will actually fill their prescriptions, that they're going to have to pay to get immunized, which means that more people are going to end up sick. We're going to have more pressures on our hospital. It's going to be more expensive for the taxpayer and better for the UCP in terms of driving the political wedge and trying to move forward further on American-style healthcare. But that's not good for Albertans.
I know too that COVID is a hot button issue, I guess. Like when people see it, it can raise a lot of emotions. But is there fear that this could trickle to other vaccines like the flu shot? If they think that uptake is low, do you think there's potential that they're like, well, we've been wasting that vaccine too? So like, where do you think it could go from here, I guess?
This is Luanne Metz. I would say that everything's on the table for them to go all anti-vax. They even referenced in their release on this that in the United States, the vaccine committee was no longer recommending COVID. That's because their new anti-vax head of the whole issue in the U.S., who's an anti-vaxxer and supports disproven ideas, fired everybody on their committee and changed the recommendation. So it was not scientists that made that recommendation. We also have a body in Canada called NACI, which makes recommendations based on evidence as to who should have the access to the vaccine. And there are groups that should have access, and we should be paying for those groups to have access to the vaccine.
All right, our next question is from Elliot, City News. Elliot, your line should be open.
Hey, can you hear me?
Yes.
Okay, perfect. Yeah, so this question is for Dr. Metz there. So when these charges for COVID-19 vaccinations take effect and healthcare professionals like nurses, doctors, so on and so forth have to pay their own way, in your experience, thinking of those in departments with high-risk patients and then their safety as well, what difference does these charges applying to them make?
When you have to pay for something, it's one additional barrier to getting the vaccine. We know that the best way to get any preventive medicine out there is to reduce all the barriers possible, such that if you don't charge people, and if you take the vaccine to them, such as in healthcare facilities. I remember working in hospitals in Calgary where the vaccine cart would come around where people could, if they chose, get their vaccine right there in their place of work. And instead of all that, we're just seeing more and more barriers. We've already seen that instead of public health going into long-term care, they've moved them so that the patients need to go out to get their vaccine. That was done over the last year, and now they're going to charge them for it. So they're really putting up more and more barriers for people and for healthcare workers to be able to get the vaccines, which means that we will have more disease, more sick people, more people dying, because there is a significant death rate in the very elderly. And we're going to see a bigger impact on our already tremendously overburdened healthcare system.
Do you have a follow-up, Elliot?
No, thank you.
All right, we'll do another pass for questions.
For Dr. Metz, since now healthcare workers will be required to pay for the shot, do you think it will be optional for them to get the shot? And would this create sort of an environment in the hospital where as a patient you may not know who is protected against COVID and who is not?
It's already optional for healthcare workers to get the COVID shot. This just will mean that it will be one more barrier and fewer will get the shot. And I mean, they have to pay for it themselves. Why should they necessarily? They're paying to protect other people even more than themselves.
All right, no more questions. All right, with that, that concludes our press conference. Thanks, folks.
Thank you.